Hello everyone, my name is Zeng Jiping, coming from School of Basic Medical Sciences, Shandong University. This section, we will study the point about what is cancer. Before the study, there are some cancer words you may hear. The first one is benign, which means a tumor that is not cancer. The second one is cancer. This is a word used to describe more than 100 diseases in which cells grow out of control, or a tumor with cancer in it. The next one is oncologist, which describes a doctor who treats people having cancer. Biopsy means taking out a piece of tissue to see if cancer cells are in it. Malignant means having cancer in it. Metastasis or metastasized shows the spread of cancer cells to distant parts of the body through the lymph system or bloodstream. Stage is a word that tells whether a cancer has spread, and if so, how far. Chemotherapy means the use of drugs to treat disease. The word most often refers to drugs used to treat cancer. Sometimes it's just called chemo. Radiation therapy describes the use of high-energy rays like X-rays to treat cancer. Remission shows when signs or symptoms of cancer are all or partly gone. After understanding these cancer words, we then go on our study about tumor. Most cancers form a lump called a tumor or growth. But not all lumps are cancer. Doctors take out a piece of lump and look at it to find out if it's cancer. Lumps that are not cancer are called benign. Benign tumors don't spread into or invade nearby tissues. Benign tumors can sometimes be quite large, however. When removed, they usually don't grow back. Unlike most benign tumors elsewhere in the body, benign brain tumors can be life-threatening. Lumps that are cancer are called malignant, which means they can spread into or invade nearby tissues. In addition, as these cancers grow, some cancer cells can break off and travel to distant places in the body through the blood or the lymph system and form new cancers far from the original. There are some cancers, like leukemia, whose meaning is cancer of the blood, that don't form tumors. They grow in the blood cells or other cells of the body. Cancer can be classified according to the function of cancer cells or the primary location. Carcinoma, a cancerous growth of surface, also called epithelial tissue of the skin, digestive tract, blood vessels, and various organs. Carcinoma cells tend to invade surrounding healthy tissues and give rise to secondary growths distant from the original location, which means metastases. Carcinoma is the most common type of cancer, which accounts for 80 to 90% of all reported cancer cases according to the National Cancer Institute. Sarcoma, often highly malignant, composed of cells derived from connective tissue such as bone, cartilage, muscle, blood vessel, or lymphoid tissue. Sarcomas usually develop rapidly and metastasize through the lymph channels. Leukemia is cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. Leukemia is caused by a rise in the number of white blood cells in your body. Those white blood cells crowd out the red blood cells and platelets that your body needs to be healthy. The extra white blood cells don't work right, whose normal function is potent infection factors. Many types of leukemia exist. Some forms of leukemia are more common in children. Other forms of leukemia occur mostly in adults. Lymphoma is a general term for cancers that start in the lymph system, which are the tissues and organs that produce, store, and carry white blood cells and fight infection. The two main kinds of lymphoma are Hodgkin lymphoma, which spreads in an orderly manner from one group of lymph nodes to another, and non-Hodgkin lymphoma, which spreads through the lymphatic system in a non-orderly manner. Myeloma, also called multiple myeloma, is a cancer of the plasma cells. Plasma cells are white blood cells that make antibodies that protect us from infection. In myeloma, the cells grew too much, crowding out normal cells in the bone marrow that make red blood cells, platelets, and other white blood cells. There are some mixed types that the type components may be within one category or from different categories. Some examples are adenosquamous carcinoma, mixed mesodermal tumor, carcinoma sarcoma, and teratocarcinoma. What all types of cancer have in common is that the cancer cells are abnormal and multiply out of control. That means some of the body's cells begin to divide without stopping and spread into surrounding tissues. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and divide to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells take their place. When cancer develops, however, this orderly process breaks down. As cells become more and more abnormal, old or damaged cells survive when they should die, and new cells form when they are not needed. These extra cells can divide without stopping. Although all the cancer cells divide and grow abnormally, there are often great differences among different types of cancer. Some grow and spread more quickly than others, such as melanoma. Some are easier to treat than others, particularly if diagnosed at an early stage, such as pylori thyroid carcinoma. Some respond much better than others to chemotherapy, radiotherapy, or other treatment, which have a better outlook and chance of being cured than others, such as Hodgkin's lymphoma and acute promyelocytic leukemia, which can be cured by all-trans retinoic acid. But for some types of cancer, the outlook is poor. For example, the 5-year survival rate of patients with pancreatic cancer only increased from 6% to 9% between 2014 and 2017. From these examples, it is discovered that cancer is not just one condition. In each case, it is important to know exactly what type of cancer has developed, how large it has become, whether it has spread, and how well the particular type of cancer responds to various treatments. This will enable you to get reliable information on treatment options and outlook. It's important to find the cancer signs and symptoms for earlier detection and treatment. Unfortunately, when cancer begins, it produces no symptoms. Signs and symptoms appear as the mass grows or ulcerate. The findings depend on the cancer's type and location. few symptoms are specific. Many frequently occur in individuals who have other conditions. Cancer is a great imitator. Thus, it is common for people diagnosed with cancer to have been treated for other diseases which were hypothesized to be causing their symptoms. Local symptoms of cancer may occur due to the mass of the tumor or its ulceration. For example, mass effects from lung cancer can block the bronchus, resulting in cough or pneumonia. The left picture shows the effect of lung cancer on the bronchus. The symptoms caused by lung cancer are similar with those of infectious pneumonia, including the appearance of systemic, skin, lung, muscular, central, vascular, heart, gastric, and joints. This is shown in the right picture. Other examples of local symptoms include esophageal cancer can cause narrowing of esophagus, making it difficult or painful to swallow. This is shown in the picture on the left. Colorectal cancer may lead to narrowing or blockages in the bowel, affecting bowel habits, which is displayed on the right picture. Masses in breasts or testicles may produce observable lumps. So, daily examination of breasts and testicles is very important. Ulceration can cause bleeding that, if it occurs in the lung, will lead to coughing up blood in the bowels to anemia or rectal bleeding, in the bladder to blood in the urine, and in the arteries to vaginal bleeding. Some cancers can cause a buildup of fluid within the chest or abdomen. Pay attention. Although localized pain may occur in advanced cancer, the initial swelling is usually painless. General symptoms occur due to effects that are not related to district or mathematic spread. These may include unintentional weight loss, fever, excessive fatigue, and changes to the skin. Hodgkin's disease, leukemia, and cancers of the liver or kidney can cause a persistent fever. Some cancers may cause specific groups of systemic symptoms, termed paraneoplastic syndrome. Examples include the appearance of myasthenia gravis in melanoma and clubbing in lung cancer. It is shown in the picture on the left, the appearance of the clubbed nails, and the red line in the right picture shows the outline of a clubbed nail. This is the end of the section. Thank you very much.